How to get pregnant with blocked fallopian tubes. Blocked fallopian tubes can be a serious obstacle to getting pregnant naturally, but there are options available to increase the chances of pregnancy. In this video, I'll be sharing what blocked fallopian tubes are, what causes blocked tubes, and treatments that can help. If you're new to my channel, I'm Dr. Amarachi Ijeoma. I'm a fertility physician, and my channel focuses on everything fertility and women's health. If this is the kind of content you're interested in, keep watching. Before I start talking about the solutions, let me quickly explain what blocked fallopian tubes are. When we say a woman's fallopian tubes are blocked, we mean that the passageway for the sperm to meet the eggs is blocked. Fallopian tubes are important for conception because they provide a pathway for the sperm to meet the egg and for the fertilized egg to travel through the tubes into the uterus and implant there. If this passageway is blocked, it will result in infertility. Blockages can occur due to various reasons, including sexually transmitted infections, pelvic inflammatory disease, that is, when these infections now travel up into the fallopian tubes and cause injury and scarring of the fallopian tubes. Endometriosis also, that is, when the tissues that is supposed to be lining the inner part of the uterus is now found elsewhere in the body, and sometimes this elsewhere is the fallopian tube, where it causes significant damage. And sometimes previous surgeries done on or around the pelvis, like appendectomy, that is, removal of the appendix, can cause injury to the fallopian tube, and this can also lead to blocked tubes and then infertility. When you're trying to conceive and you have blocked tubes, the only proven and effective method is in vitro fertilization, popularly called IVF. IVF involves collecting the eggs from a woman, collecting the sperm from a man, putting it in a dish outside of the body, allowing the sperm to naturally select the eggs and fertilize it, then leaving it in the incubator for about 3 to 5 days. The incubator is an artificial uterus. It mimics the environment of the uterus. So after 3 to 5 days, the embryo that is formed will now be transferred back into the uterus of the woman. This procedure, this IVF, bypasses the fallopian tube. It provides an alternative route for the fertilized egg to implant and grow. IVF has good success rates and can be an excellent option for individuals or couples with blocked fallopian tubes. Another option is surrogacy. Surrogacy can be an alternative option to achieve pregnancy. With surrogacy, you can use your egg or eggs retrieved from a donor and fertilize with your partner's sperm or a donor sperm, then transfer to another woman's uterus. Surrogacy can only be done with IVF, and it involves a woman, that is the surrogate, carrying the baby and giving birth to the baby on behalf of another person or couple. These options allow individuals or couples to experience pregnancy and parenthood despite the challenges of blocked fallopian tubes. Some of my patients have brought up the option of a procedure called hydrotubation. Let me tell you something about hydrotubation. Okay, it's a procedure that involves attempting to flush the tubes with a solution in an attempt to open it. But it is a very old method. It was being practiced several decades ago before the introduction of IVF. Studies have shown that it is not an effective method. Right now, it's only a few places in the world and a few doctors, usually the elderly doctors, that still perform this procedure. Yes, getting pregnant with blocked fallopian tubes can be challenging, but it's not impossible. Options such as IVF, using your own egg or a donor's egg, or even surrogacy can help individuals or couples to achieve their dreams of starting a family. It is important to consult with a fertility specialist who can assess your specific situation, provide the appropriate guidance, and recommend the most suitable treatment option for you. Remember, infertility challenges can be emotionally taxing, but there are treatments available that can offer hope and increase the chances of pregnancy. As usual, I am wishing you success on your fertility journey. If you have found this video informative and you want more content like this, subscribe to my channel, like this video, share with your friends, and see you in my next video.